We're talking today with Dr. Grace Wright, rheumatologist or joint specialist, about psoriatic arthritis, which is associated with psoriasis. About 2 million people have psoriasis, and about 1 in 4 of them has psoriatic arthritis, which is a painful condition. So that's what we're going to be talking about today. Dr. Wright, what are the signs and symptoms of psoriatic arthritis?
The psoriatic arthritis, or PSA, can present in many ways. When we think of this chronic inflammatory disease, the first things that come to mind would be stiffness. That can occur sort of throughout the entire body. Swelling of particular joints, so you can see swelling in the hands, the feet, the knees, the shoulders, the elbows. And then there's a lot of pain, and pain that is also present just when you're sitting still because of the swelling in the joints, or pain when you initiate movements. When you start to move, you get up from the chair, you twist your neck, and that happens because there's inflammation where tendons insert onto bone. And so the stiffness, the fatigue that comes with this, the swelling, and the pain, those are the classic signs and symptoms.
Okay, now is psoriasis an autoimmune disease?
Yes, psoriasis as well as psoriatic arthritis are really just two different manifestations of this chronic autoimmune inflammatory disease. And so we have to treat it differently than we treat many of our other skin-type lesions, which may be allergic or some other source of the inflammation.
All right. And what are the treatment options? How does one go about treating?
Well, there are many treatment options for psoriatic arthritis. We have oral agents or pills, many of which sort of target generic inflammation in general. Then we have more targeted agents, and then the most targeted would be the biologic class. And these are complex proteins that are grown in living systems and target the immune system either by targeting the cells of the immune system or the various molecules and chemicals that are involved in the crosstalk between these cells, leading to the inflammation. And since I'm here working on behalf of Novartis today, just to highlight one such option is a drug called Cosentyx, which targets a particular inflammatory molecule that drives the inflammation in both the skin, the joints, and the tendons. And when we use agents like this, it's important to remember the potential side effects as well as the benefits, so that we're always concerned about serious infections, allergic reactions, and in some cases inflammatory bowel disease.
All right. And is the treatment the same for adults and children?
There are some differences in the way that we treat children. There are some agents that are approved for use in adults only and others that really span the full spectrum. But in general, it's the same approach to treatment, that you use either the oral agents or these targeted complex biologics.
All right. And what about the difference between the psoriatic plaques and the psoriatic arthritis?
So the psoriatic plaques really are these thickened, scaly, red, itchy plaques on the skin. They tend to occur over the elbows. We can see them over the knees. But there are patients who are covered with large surfaces of their body. They can be on the chest, the back, the legs, the arms. The scalp is another area, or inside the ear. So this is the same inflammatory response, but it's targeting the skin. Psoriatic arthritis can coexist with psoriasis, or it can occur before the skin becomes so obvious.
I see. So it's basically the same condition, but with different manifestations?
Exactly. And there's some people who get psoriasis and never get the arthritis, but there are those who really do have a mixture of both, either at the same time or at different points in their life.
Okay. And as far as the treatment is concerned, it can be oral therapy or injections or phototherapy?
Well, for psoriatic arthritis, we don't use phototherapy. It doesn't affect the joints as well, but the biologics are either given by injection or by IV infusion. phototherapy is used in some cases to treat just plain psoriasis.
I see. Okay. I had another question for you. Is the choice of treatment depending on the severity of the illness?
Yes, so depending on how severe either the skin or the joint or both are, then that's one of the things, a very important aspect to take into account for what kind of therapy is used.
Okay, and one other question. Is there a good source for the general population to get additional information about psoriatic arthritis?
Yes, we're going to send over some websites that will give really sort of good general information that will include the ACR website, that's the American College of Rheumatology, Psoriasis Foundation. There are a variety of websites, and we'll send over the links for you so that you can share those with your audience.
Okay, well, this has been very helpful information. I'm sure my Health Power audience will benefit from it, and I want to thank you very much for sharing this information with them.
Thank you. You're very welcome.
All right, have a good day now.
You too.